Well, good afternoon, everybody. It's really a pleasure to welcome everybody here for our first Investor Day. My name is Martin Thor. I'm the founder and director of Tolion, and it's really, again, grateful for all your presence here. We have a lot of people on the online broadcast, so we need to start on time. And if you have any questions during the presentation, just ask for the microphone so actually they can hear you. So I'm going to go straight to the agenda. And I'm going to talk a little bit how this company came about, what is the vision for the company, why we decided actually to do this adventure. Then I will introduce some of our key collaborators. There are some really famous people from business, from tech, from sports that actually will share a few words. I'll have my colleagues from the US organization talk a little bit about the business and about the data. And then Ondra and Katka will talk about, who are our medical team, will talk about the importance of brain health. The main topic for today is going to be the introduction of the Tolion Brain Coach, our first product. And then we'll have a Q&A. So again, it's really a pleasure to see all of you here. We have a lot of our friends, our investors, our collaborators, a lot of people who supported us over the fairly brief history of Tolion. Actually, we just founded the company about 2 years ago. I would like to, at this point, actually thank two ladies that actually have been responsible for organizing all of this. Lenka Kratochvílová and Teresa Kulhánková. At least Teresa is here. So this is actually why we're here. This is actually, they need a round of applause. Teresa runs the communications. And Lenka is obviously too busy actually to be here. So I'll start with this quote. I really like this quote because I think it captures very well the spirit of this team. The task of improving brain health and improving actually health of people and longevity is obviously a huge one. But again, I think we have a very special solution, and we're already hearing the feedback that this is really important for many people. So this is Steve Jobs. So this is the task at hand. When we start to think, and it was primarily with Jarda, who will actually talk about kind of his experience in just a little bit. The current medicine, the problem with the current medicine is that it's a sick care, right? For those doctors actually in the audience, you will know that we see patients when they are sick. They come to see us when they are sick, which is really a wrong approach, and really the issue has been for the longest time, and this is what we now can solve with the technology, how you actually design a preventive care for individual people. So the three tasks that we actually set out to solve was, number one, how you deal with the medical knowledge. The problem of medicine is that there are, I heard actually the number from Andrzej, there are 20,000 papers on brain health every year published, and it's impossible for anybody not only to read it, like actually make sense out of it. So this is the first application of the AI that we actually use. The second is, how do you follow patients and how do you design a program for them on the individual basis? How you actually can make sure that you have designed the treatment or preventive paradigm actually for individual people. So that's the second one, and how you connect the two. So this is the other part actually where the technology has been absolutely essential. And the third one, which has been a big surprise for me, we also need to make sure, because our approach is to actually have intervention in the people where they are still healthy through the lifestyle interventions, how you make sure that they change their behavior. So the third application of the AI is coming from our psychologists, but designing the plans so they actually make any changes to their lifestyle. So a little bit of my introduction. So I'm born and raised in Prague. I spent all my important years actually here in the 20s. I started at the computer science. That was my first school. Then went to medicine. Then went to US. Had an opportunity to work as one of the Nobel laureates at Columbia, Eric Kandel, who got a Nobel Prize for Learning and Memory. And then trained in Boston. Went to Yale. Was there on faculty. And then was really frustrated with the lack of treatments for brain disorders. So 20 years ago, there was really very little we can do. And that brought me to Pfizer. Initially, I worked in the clinical development, and then they sent me to business school so I can run the business group. And that was really my opportunity actually to build companies and run companies. I founded a number of companies and ran a number of companies, and you will see actually that the same people was the same people. The only reason I can do it is because I have a good idea, but these guys actually do all the work. The kind of the most relevant company right now is a company called Alzion. Ken and Adam, the two people who actually joined us here at Tolion, have chief roles at Alzion as well. And we're really, the reason why we can actually so quickly build this company and get to where we are is because actually they were able to help us with this. At Alzion, we have really for 12 years now been working on the key issues of Alzheimer's disease. One, what is the toxin? Two, how you find the patients with Alzheimer's. Three, how you follow the patients, how you can actually follow them with biomarkers, with imaging, and four, what is the role of genetics. And we were able to publish kind of the key findings that allowed us for us to develop a treatment. We have our oral treatment, really the only late-stage oral treatment that can change the course of the disease. And now we're talking with the regulators in the US about the approval. Now, and I'll go to the next slide. Really, the inspiration or the idea for Tolion has been that we had a lot of the caregivers, right? So we deal with the people who have very high risk for disease, and they come to us, and the healthy caregivers were saying, well, can you do something for us? And for the longest time, we were saying, well, we cannot really do anything. But then it turned out there was a lot of literature on healthcare, on the lifestyle intervention in health, and how it actually impacts health. And that's actually where we said, well, maybe we can consolidate the knowledge, apply it to individual people, and actually change their trajectory, their risk profile, and their trajectory. So that has been really the initial idea. And as you can see here, you have about 20, 30 years before the brain starts failing, before you get to the clinical stage where we can actually intervene. Again, what we call Alzheimer's disease is the terminal stage where you have the symptoms when the brain is literally failing. So for 20 or 30 years, the computer in our heads starts disconnecting, and then when it really starts failing, you start to get the symptoms. So this is our opportunity, and it's actually, since everybody is at risk for Alzheimer's, and every fifth person in this room has the high risk gene. So that means they get the disease much earlier and it's more aggressive. It's actually quite an opportunity to intervene then. And we also, for all these reasons, initially focus on the patients who do have high risk for Alzheimer's disease. Now, if you think about the burden of Alzheimer's right now, so first of all, the major risks are age. If you live long enough, virtually everybody will get Alzheimer's. There's about half of the people will have the terminal disease in the 90s, and about a third in the 80s. The second is sex. Women have 60% higher risk. We don't really fully understand why. And the last one is the genetics, the ApoE4 gene, which again, every fifth person on the planet has. That translates into the burden of the disease with the brain pathology. It's estimated 416 million people on the planet, so almost 500 million people actually have the disease. In the terminal stage, it's about 50-60 million people. So we initially, and we actually, you'll hear it from the other presentations, we're working closely with the patient advocacy groups and patient organizations that actually work with these high-risk patients or with the patients who already have the disease. So just a very quick introduction. Both Ken and Adam will introduce themselves, but Ken has been an awesome finance guy. He has a phenomenal career, as you can see here, in the small companies, in the large pharma, in one of the top VC funds on the planet, and has been with us actually at Alzion for about a decade, and then from the very beginning really helped us found Tolion. Adam has been one of the star employees at my previous company called Gnome. We were the first ones to start really analyzing what the whole genome means, right? So in 15 years ago, when for the first time we could analyze the whole genome, the good question that George Church, one of the luminaries at Harvard, had, well, what does it mean? How we're actually going to analyze this? And we were the first company to start really doing the whole genome analysis. We were one of the largest users of Amazon Cloud, and again, that was kind of the breakthrough with that. And Adam was one of the young engineers. Ever since, he worked at some of the big hospitals in Boston, at Dana-Farber, as you can see here, at Mass General, and then came back to Alzion to run the data group as a chief data officer. So and Yarda, my really the gentleman who actually together we talk about this company for about 4 or 5 years, has been incubated for a while, and it's incredible actually that we have now 50, 60 people actually in this organization, and we are just about ready to release the product. So with that, I'll turn it over to Ken to talk a little bit about his perspective on the value of this company.
Thank you, Martin. Appreciate it. And thank you. This is my first time in Prague, so thank you for the invite. A beautiful city. Really appreciate it. I love this picture because, as Martin said, I've been working with Martin for 12 years. I had no gray hair in that picture. So as you can see, after working for 12 years at Alzion, I have a lot of gray hair. But in addition to that, when I started my career, I have 25 plus years of corporate finance experience across all life sciences. So I helped with international expansion with Boston Scientific. I did an IPO with ViaCell in the US. As Martin talked about at Flagship, I was supporting over 30 of their startup companies. Flagship is a VC firm which creates their own companies. Moderna is an example of the company that they created. But I've also worked on the M&A side. So I worked for a startup biotech company which was acquired by Roche. After the acquisition, Roche offered me a position in Basel, so I love being back in Europe. I love being here. I worked in their strategic planning area with their long-range planning and their short-term target forecasting, but just really thought I could make a bigger impact coming back and working for a company like Alzion. And that's why I'm here, and now I'm involved with Tolion, and it's extremely exciting, and I can't wait to see where this goes. I'm going to tell you a little bit about why you should be excited as well. Who needs another brain health app, right? There's a lot out there. But why is it important? It's important because we know that there's 55 million people today living with dementia, and it continues to grow. And it'll be significant growth over this time period. Dementia is largely preventable, and this is where this app comes in. And Katka and Andre will talk about some of the risk factors coming up in a little bit and why it's so important. Public awareness of these cognitive diseases are becoming more and more, and people want to educate themselves about this. And while educating themselves, everybody has an iPhone, everybody has technology, everybody has other apps that they're using, which can contribute to what we're going to talk about a little bit in the Brain Coach. Some of the things that are very important and link between Alzion and Tolion, as an example, Martin talked about our experiences at Alzion, where we went after the highest risk patients, subjects that have 2 copies of this ApoE4 gene. And what we've heard from them is they really want to empower self-management. And as Martin said, there's nothing out there for them right now. And they know what's coming. And that's why this could be extremely helpful for them. And the other thing that we know from Alzion and the data that we have, the earlier you go from a prevention perspective, the earlier intervention, the better results that you're going to get. And so from this perspective, you can see the links between both Tolion and Alzion, and this would be able to provide something before you have symptoms, before it's too late. And where is Tolion now? Well, the great thing is you all will have the ability to download a beta version of this app. And why that is great is because right now is a time that's actually something there that's been developed that you can actually feel and touch. When we launch this in later on this year, that's a value inflection point from us, and that's when kind of the value of this company is going to go up extremely fast. So for those people who are investors here in the Series A, you invested at the right time because this is the best time to be an investor in Tolion. And if you're interested, after you see the presentation today, this will be the best time to get in because it's a Series A, and that's the best value to get into a company. Because after we launch in the U.S., we're looking to launch both in Europe and then globally in the following years. And what could that look like? Well, what we know is that there are other apps out there and the potential value of what those companies are look like now. But we know in today's environment, the exponential growth of these technology companies, and this could just be the beginning. So if you're interested, please stop and talk to any one of us. I'm looking forward to meeting all of you, and I appreciate your time.
He deserves an applause. You see why he's the CFO. So Adam is the next one. Adam, you got the floor.
Yeah, good morning and good afternoon, everyone. Adam Albayrak here. So in addition to my role with the Tolion team leading the US data and product strategy, I'm also, as Martin mentioned, Alzion's chief data officer, where I'm really responsible for the statistics, the analytics platform, the data science that we're doing to develop a drug for early Alzheimer's targeting APOE4 patients who have the highest risk of Alzheimer's. So, but my background has always been in building systems in precision medicine environments, whether it be in startups doing it for a commercial endeavor, but also trying to get closer to the patient to understand how does this R&D, how does genomics fit into the clinical workflow? How do we actually make an impact in the clinicians and the patient's lives, where we integrate genomics data, clinical data, real world data, and deal with a lot of the complexities that are going to be unavoidable in any of these situations when it comes to data integration, consent, working with electronic health records. These are all very big challenges. And it takes a good team like what we've assembled here at Tolion to kind of overcome all of this. So when I think about the challenges and the opportunities we have here, it's really twofold. And if I could have the next slide, number one is on the individual basis. This is kind of the most direct solution that we're building today at Tolion, right? It's the Brain Coach app. It's the knowledge base that's underlying it. And what this is really meant to overcome is a lot of the deficiencies that we have today. So EHR data in the US is vastly underutilized. You have a lot of data about patients that live in the EHR and they don't go much further beyond that. So patients aren't really benefiting from it beyond their 10, 15-minute doctor's visit today. Wearables, right? We're starting to push for things like Apple Watch, Garmin, even the politicians are pushing for this now. And so there's going to be a lot more support for this being funded. But how do we actually translate that into action that helps prevent dementia? That's still an unmet need. As Martin mentioned, there's just tons of literature out there. There's podcasts, there's people on Instagram posting about how do you prevent your dementia risk. But to reconcile all of the contrasting opinions and findings is really, it's hard for anybody, even an expert, to do, let alone your typical person who's concerned about dementia risk. And then, of course, you have the multimodal data of the patient themselves and trying to digest what to do based on your risk, based on your genetics, based on your activities that you personally choose to engage in. And these are all challenges that we're addressing now with Tolion, with our data integrations, with our collaborations with teams like Garmin, the Med Portal, which is really an AI-powered system that actually it's powering our neurologists, our neuroscientists to develop a knowledge base of recommendations that does all the heavy lifting for you of deciding what actions to take based on a particular patient profile. So it's really an exciting opportunity on the individual basis. But then what I really get excited about, and this is where I've put a lot of effort in, not only at Alzion, but even in my previous role where I was working across many different health systems, data to make a system available to pharma and life sciences who are trying to recruit patients for trials, trying to run real world data studies to kind of increase the efficiency that you can make discoveries and make value propositions for a particular pharmaceutical product or medical device. I see a huge opportunity here with what we're building with Tolion, because that same user base who are going to benefit from the Tolion Brain Coach app today for prevention, they're really also going to fuel a dementia prevention registry, because now we have Alzheimer's drugs that have been approved for the first time in decades. What that means next is dementia prevention studies are on the rise, and these are already started happening, but these are very costly studies, because finding patients to enroll, finding the right patients who are going to progress to disease and comparing them to patients who are treated, that's really difficult to do, and it's expensive. And then running real world data studies, they're really limited to the clinical data, which is it's highly variable. And the biomarkers that we have today are also highly variable and unreliable. There's new biomarkers coming out every day. There's really no registries that have good patient reported data. So what we're building here with Tolion, it's going to have that patient reported data to go alongside with the clinical data and have ability to add in biomarkers too. And this is going to be able to power something that could benefit not only the patients today, but also the pharma and life sciences who are trying to kind of lead the next generation of therapies for prevention, in addition to the lifestyle changes that we're making thanks to the Tolion Brain Coach app. So I'm really excited about both perspectives, and hopefully you all are too, and looking forward to what's next.
Thanks, Adam. Okay, can I have the next slide? I'll move it. So I actually follow on what Ken and Adam have been saying. So my experience talking to investors and actually a lot of people, a lot of stakeholders about Tolion is that I always talk about Alzion and then followed with Tolion, and most of those people say, well, can I sign up for the app, right? I mean, the Tolion actually has been tremendously attractive, the concept of preventive care and so forth. And we have a lot of actually important meeting in the US coming up. We're going to be meeting with the commissioner for the Medicare, Dr. Oz. And for those who don't appreciate the healthcare costs in the US, he spends about $2 trillion a year. And out of that, actually, about 25% is actually on Alzheimer's disease. So for the U.S., addressing both therapeutically, the terminal stage, but also preventively more so, is incredibly important. And as you heard, again, there's a lot of cross-pollination between Alzion and Tolion on the science, on the trials, on the understanding of how the patients behave, how they actually get from the healthy state to the disease state and so forth. So this has been very fruitful. So the vision for Tolion was grow young together. I mean, you heard probably from a lot of the people who are working on the longevity that we're getting close to the singularity, and everybody will die, everybody will get younger. We're not there yet, so until we get to that point, I think you will enjoy actually using our app. But again, our initial target has been brain. I've been working on the scientific, on the clinical, and so forth basis, of the brain problems for the longest time. But again, if we can fix the brain, we're probably going to help the whole body. So this is the connection between brain health and longevity. So we have a lot of very good athletes on the team. I'm not going to tell you how much these guys are running and lifting and what have you. But this is an example. This is one of our one person on our medical team, Tomáš Cvrk. He's also a guy from Prague. He studied biology in Prague, and then he went to Texas, got his PhD. Then he decided that he wants to be a doctor. He applied to medical school. He only got to Harvard, so he had to go to Harvard. Then he trained in Harvard, and he working as an anesthesiologist at one of the top clinics. And the concept that actually we're going to hear a lot about here is the health is function, right? So we should define health not that you're not sick, you don't have a disease, lack of disease, but actually how much you can do. So again, it's investment in yourself if you can actually improve your fitness, improve your ability to do things. And we're going to hear actually from Jirka and some other people actually how important that is in the sports, but also in life. So Tomáš, as part of his training, decided to climb the highest peak in the Americas, Aconcagua. He trained for this over a year. He said it was the hardest thing he has ever done, and this is actually where he's still climbing. Several of the people actually on the team decided to give up, but you're going to hear the finishing of this story a little bit later. So what are we trying to do here? You know, a lot of us are here are doctors. We are used to, if there are these difficult medical problems, have a concilium, and really you can have with this tool, again, as I said, consolidated medical knowledge, understanding of the individual profile, and then ability to connect the two with the recommendations, plus change in the behavior, kind of tracking how you're actually adapting to it. So you have medical concilium in your pocket. You would have a tool that would actually grow with you, that would live with you, that would help you actually improve your health, and you can see exactly the effect of actually what you're doing. That's called biofeedback. This is one of the best things actually you can do for actually, you know, changing the behavior. And ultimately, our goal is to integrate these tools into large medical system, you know, payers are interested and so forth. And you're going to hear later from Petros Matlo, our Chief Business Officer, how we're approaching this. We want to test this app with the consumers. This is called business to consumer. But ultimately, this is something that the hospital system, the payers, and really the organization that spend the most money and have to take care of, actually, of the sick people would be most interested in. So this is ultimately the integration. And as you can see here, actually, Tomasz has reached the summit, unlike some of the other folks. He said this has been really eye-opening experience in both how you prepare for it, but how it helps you actually live much more fruitful life afterwards. And his experience has been also essential because he's the guy who, as you can imagine, as an anesthesiologist, you know, he's just watching the data. You know, he's like us. You know, he's actually analyzing the data. He cannot talk to the patients, but he actually will have to make a decision and make the recommendation just based on the data. So we're been very successful in attracting some of literally the top leaders in the tech, in the business, in sports to work with us, who've been attracted to us. And one of the key people actually in the health tech has been Greg Moore. He built a business at Google, the health business, then at Microsoft. Now he's working with Bill Gates on his venture fund. Bill Gates, I think I can say that, has about 250 billion, and he wants to spend it in the next 20 years. One of his big areas of focus is actually brain health and Alzheimer's disease. So with that, Greg, please.
Thank you, Martin. It's a real pleasure to be here, and good afternoon, everyone. Today, it's it's a great day to be here in Prague for Tolion Health's Investor Day. As Martin mentioned, I've been really blessed to have the opportunity to spend my career at the intersection of both medicine and technology. Martin mentioned I'm a physician, but I'm also an engineer. And I'm a practicing neuroradiologist and neuroscientist, and then subsequently I got pulled into tech because I was studying informatics and data, and and I really had a passion to have reach, broad reach, global reach, and to scale what we could do with tech to help healthcare. And I was able to do that at some significant companies that Martin talked about, and it was a real privilege, and it taught me how to scale and what scale could mean, and particularly what it could mean for global health. So I'm really honored that Martin asked me to go after one of my own personal passions in brain health to serve here as a strategic advisor and a board member at Tolion Health. So thank you for that, Martin. Over the years, I've seen countless health-related startups, but very few with a combination that Tolion offers. Tolion offers scientific rigor, thoughtful design, and, as we just heard, a truly global ambition. From my first conversations with the team, and I see some of them here, including a deep dive, technical deep dive with a team in Prague earlier this year, which I'm sure the engineering team remembers. It was clear that this was just not another wellness app. Tolion's building a clinically credible AI-powered prevention platform for brain health. And that matters because prevention is not a slogan. It should be measurable, personalized, and achievable in daily life. What excites me about the Brain Coach is how it transforms science into daily practice, as we just heard. Brings together more than 100 scientifically validated measures and factors, things like sleep and exercise to cardiovascular health, mental well-being, and even environmental exposures you'll see, and turns it into clear and actionable coaching. Instead of vague advice you may have received by your own physician, like you should sleep more, the app can say, if you had 30 minutes of sleep, here's the expected impact on your brain health score. That translation of complex evidence into practical steps is really what makes Tolion unique. The potential here is really enormous. Millions of people in midlife carry risk factors for cognitive decline, but they don't show any symptoms, and they might not even know they have the risk factors. They are the group, those in middle age, that are most likely to benefit from preventive coaching. For clinicians like myself, Brain Coach extends care between visits. For employers, it supports long-term workforce well-being and health and productivity. And importantly, and perhaps most importantly for underserved communities, something I'm passionate about in terms of global health, it democratizes access to credible, high-quality expertise. If we can shift even a fraction of the population's risk downward, the payoff is staggering. Fewer cases of dementia, lower healthcare costs, and families spent years of difficult caregiving. More broadly, we are entering a new era of healthcare, and I think unless you've been under a rock, you've noticed that. It's this new era of AI-powered healthcare, and AI-powered everything, really. But that hasn't got to the brain yet. In cardiology, we prevent heart disease with statins. In oncology, we screen early for cancers. But in neurology, and I know there's neurologists here, we often wait for symptoms to appear before we act. With Tolion and its AI-powered technology, we now have the opportunity to move upstream, as we heard earlier today. So moving upstream is key here. Using AI not to replace doctors, but now to act as a co-pilot, or I would rather say a partner, for both patients and the chosen healthcare providers to deliver that right information to the right person at that right moment in time for them. It's really why I chose to actually engage here in Prague with Tolion, here as a strategic advisor and board member. I believe the company is not only building a product, but shaping a future where brain health and prevention is practical, scalable, and again, truly global. I'll end with this. The best time to protect your brain was 20 years ago. The second best time is today, right? With Tolion, that future starts here, and I'm excited about that. So thank you for the opportunity, Martin.
Thanks so much, Greg. Again, Greg had very direct feedback for us earlier this year. And already we're making changes. Actually, we have made a lot of changes to how we design our app, how we design the business, and so forth. So I'd like to introduce our next really important collaborator, Jirka Dvořák. He's a dear friend. We have been talking about the concept of brain health for the longest time. He's also a revolutionary. He actually ran the 68 revolution. I, with some of my friends, ran the 89 revolution. And he unfortunately had to escape to Switzerland, where he had a really stellar career, both in neurology, but also at the FIFA. So, Jirko, please.
Well, thank you very much for the introduction. And let me just continue in the arguments which you have received from Ken Mace and Greg Moore, why we should support Tolion. They gave you some arguments from the business perspective, and I will give you some medical and scientific reasons to substantiate Ken's and Greg's statement from my personal perspective. I am Professor of Neurology, Emeritus, at the University of Zurich, and former chair of Department of Neurology at the Schultes Clinic in Zurich, the number 4 orthopedic clinic in the world. I have published 423 papers. I checked that yesterday. My H index is 142 with 80,622 citations of my work. During the 23 years, I was Chief Medical Officer of FIFA, responsible for 6 consecutive World Cups starting in United States 1994, 5 Women's World Cup, and 5 Olympic Games. During this time, I have observed a lot positive and also negative aspects of sports. One of them is head, brain injury, and concussion. Contact sports, also martial art, such as rugby, American football, number 1, hockey, and also soccer, are prone to concussion. And consider, there are 1 billion people exercising this sport around the world. 1 billion. Exposure to repetitive head impact could lead to alteration in brain structure and function, as we are talking about. Long-term changes might develop to neurodegenerative diseases, such as dementia, Parkinson, and other. Last year, one of the icons of the American football, the Czechs don't know him, but the Americans here, they will know him, Brett Favre, visited me privately in Zurich. As American football quarterback of all times, he played 20 seasons consecutive, was diagnosed at the age of 54 with Parkinson's disease. He sustained several concussions in his career. And now I will read you the most important sentence from my talk. The early recognition and monitoring of symptoms development determines therapeutical and even preventive strategies. I repeat again. The early recognition and monitoring of symptoms development determines therapeutical and even preventive strategies. I am in the field for more than 30 years. Co-founded the Concussion in Sport Group 2001 in Vienna. We had a consensus meeting in Prague 2004 and co-authored 5 consensus statements, a state-of-the-art publications with cumulative citation of 15,750. If somebody is involved in concussion, he has to read that because this is the state-of-the-art of the top scientists in the world. And I can assure you, there is no other tool to recognize and monitor and positively impact the symptoms and signs potentially leading to neurodegenerative diseases than Tolion Brain Coach. That's the reason I am so excited to be part of the journey as strategic advisor to the team. Thank you very much.
Thank you, Jirko. In fact, you know, it's not just the prevention, but you can even actually prepare for the head injury. So it's really interesting because the pathology, we call it neurological sequelae of actually head injury, could be alleviated actually if you can prevent, if you know actually that somebody is at higher risk to having those. Can I have the next one? So David Nicodem is another very dear friend of mine. He has a Czech pedigree as well. His parents actually escaped in '68 to America, and he spent a lot of time with his grandmother in Pardubice. This is where they make the really good cookies. But he then trained, as you see, he got his PhD. He worked on the Wall Street. He worked in a number of investment funds, and in fact, he was the first institutional investor in Alzion. He led actually that round actually, which is now, I don't know, 10 years ago, over 10 years ago. And for those speaking Czech, it was really funny because when I finished my presentation in English actually to this big fund, he said, to bylo na jedničku s hvězdičkou. So David, you got the floor. Okay, so we're having some technical difficulties, which is okay. Actually, we'll patch David in later. Can I get actually to the strategic collaborations? Go to the next section, please. So again, we were over the past year, once the idea for the application and kind of the idea of what the business and how we're actually going to go about it, talked to a number of large institutions in the US and actually globally. What has been really surprising, number one, that there's no similar solution actually for brain health. Number two, how much actually desire is actually to have this solution in the clinics. One of the key partnerships actually was Emory Clinic. You're gonna hear about it from Petros Matl in just a little bit. This is a clinic where in Atlanta. This is Emory University. They have about 150,000 patients coming through the clinic every year, and they were hoping to develop some kind of health, brain prevention tools, but they really were not successful. So they are really looking forward to integrating actually our solution there. The other one is so we at Alzion work with a lot of the advocacy group in Alzheimer's disease. It's the group called Us Against Alzheimer's, the major advocacy group in Washington. Again, that was the same response. They tried to develop some kind of tool that addresses brain risk or brain health risk, but they really haven't been able to provide any solutions. So again, to me, has been striking how much really need and desire is actually to have this tool. I'll mention actually one other. So Bruno Vallas is one of the key luminaries in Alzheimer's disease research. He's based in Toulouse, and he's running the largest longevity study on the planet with about 2 million people. And again, he would like to integrate our tool in there because he wants to have actually this ability to help patients with the brain health. So I'm hearing that David Nicodem will be able to tell us a few words. David? Oh, there you go.
Hi, everyone. Sorry about that. I couldn't unmute and unvideo myself, so I'm here. Thank you, Martin, for the introduction, and sorry I couldn't be there. I would love to come back to my homeland in Prague. My parents immigrated in 1967, so I've been there several times visiting my grandparents and relatives. My background, as Martin said, I've known him for more than 10 years now, and he came to me at Tolion. I've spent 25 years in the healthcare world, first as an investor on Wall Street, running a healthcare portfolio, and then last 8 years as a CEO of diagnostic companies, first in pharmacogenomics for mental health, and now recently in fatty liver disease. And I've spent time in New York and then East Coast and also in Europe. So I have a strong US and Europe EU network, and I'm very excited to be part of this company. What really attracted me was I have a big sweet spot for population health, so really making a difference, whether it's mental health, Alzheimer's, dementia, but with 400 million patients at risk globally for Alzheimer's, this is exactly what I'd like to try to make a difference and try to change the paradigm we have now. So the second slide is why Tolion. Really there's many different clinical manifestations of Alzheimer's, dementia, mild cognitive impairment, but there's the balance there to try to stabilize that and reverse that. And so how can we do that? And one of the things as a scientist by training is to really appreciate that you have to marry the medical science part with practical function and purpose. So what I really liked was the MedWiki medical knowledge base that the Tolion team has created by taking these 20,000 publications on brain health annually and then using AI to facilitate gathering all these biofactors, biomarkers that are important in what we have to focus on. So that evidence-based knowledge and scientific and marrying it to the brain coach is what really is going to be important for key opinion leaders, regulators, insurance companies, and I think that that's all stepping in the right direction. On slide 3, I don't know if you can see the slides, but I don't know if I'm supposed to be sharing, but I had sent them to Teresa, but there we go. Slide 3. So what are we going to do in the U.S.? I think that the world is our oyster in this. And when I first joined, I said this is just another brain app. But when I started seeing all the science and the app, I really, really appreciated it. So what we'll do is in the U.S. is really set up the legal structure first, and then partner with some of the companies, such as diagnostic companies in Alzheimer's, as well as down the road of accountable care organizations, Medicare, state organizations, large employers that employ tens of thousands of people. All these people need to keep their employees healthy and to lower costs to the system, and that's very important. And we'll be able to build a strong network and really to find those champions in industry and in science that really appreciate our endeavor and that will speak for us at medical meetings in front of regulators and just start building from the ground up this network and these opportunities. So, for example, the first I think as a diagnostic person now, I think one of the first things is talk to people that have diagnostics in Alzheimer's or dementia. So I spoke to my friend who runs a company, and they have a reimbursed test for Alzheimer's. It's 96% accurate with some of the more invasive PET scans and such. And they have reimbursement, as I said, and they have sales and marketing. They have a very good web-based platform, but they can't get traction. So I asked the CEO, I was like, "What's going on? The data looks good. You have a really good diagnostic." He goes, "Well, the patients say the same thing. I'm happy to take a diagnostic test, but until there's a treatment option, I don't really want to take it. I don't really want to know that I have early dementia, early cognitive impairment. And so without a treatment option, I don't want to go on the injectable, infusible drugs that cause a lot of ARIA and side effects. So I think this is where the Tolion Brain Coach can come in. And as one of the previous speakers says, this isn't replacing the doctors. It's really creating a co-pilot. And so by coupling on a commercial standpoint, by working with this diagnostic, for example, we can partner with them as a non-exclusive, get on their platform and have them offer us as a potential solution for these patients that they are diagnosing. And that way we can have this low-hanging fruit and ability to start entering the market with these types of partnerships. So that's just an example, but I think that there's many that we can work on, especially with Greg and Wendy in the U.S. and strategize how to get that. So in closing, again, population health with 45% of dementia cases being preventable by modifying those risk factors, I think we can really help these patients and really make a big difference globally. So thank you, and I'm very happy to join the team. And please contact me if you have any questions or would like to discuss further.
Thank you, David. So as you heard, I'll talk a little bit later about the corporate structure. So we're a Delaware company. We have the Czech subsidiary that actually developed all the goods, developed the product and everything, and then David would lead the unit or the subsidiary that actually would, the commercial unit that actually would commercialize the product in the US. And again, he started to talk about already the B2C, but also the B2B approach that you're going to hear more from Petr Zmátla. So next person I want to introduce is Wendy Weber Nelson. She is somebody, again, we have been working with for a long time at Alzeon. She leads Boston Biotech Forum. As you can imagine, Boston Biotech Forum kind of combines everybody and anybody who does anything in biotech science and investment in Boston, one of the key hubs on the planet. But she also leads, she's one of the leaders of APOE for Alzheimer's Alliance. a group that really tries to increase awareness and help develop treatments and preventive strategies for people who have high risk for Alzheimer's because of the ApoE4 genotype. Wendy, you got the floor.
Thank you, Martin. Hello, my name is Wendy Nelson. I'm a PhD scientist by training and have spent more than 25 years working across biotechnology, pharmaceuticals, clinical research, and venture development. I founded my Boston Biotech Forum almost 15 years ago. I've advised global organizations and worked on both the scientific and business sides of healthcare innovation. But today I'm here with Tolion Brain Coach for a more personal reason. Unfortunately, I am an ApoE4 homozygote, which makes me part of a community of people with a much higher genetic and familial risk of dementia. For people like me, brain health is not an abstract concept. It's something we think about every day. That's why I believe Tolion Brain Coach is so important. It takes what we know from science and medicine and translates it into practical preventive tools that individuals can use to monitor, protect, and improve their brain health. It's not about waiting until symptoms appear. It's about acting early, making smart choices, and extending brain span to match lifespan. Why does my expertise matter for Tolion? In my career, I've helped bridge the gap between science and business, from drug development to clinical trials, from startups to large pharmaceutical companies. I've seen how critical it is to bring the right innovation to the right people at the right time. With Tolion, I can combine that professional experience with my personal perspective as part of a high-risk cohort. I understand the urgency, the questions, and the hope that people like me, my family, and my community share. And I believe Tolion can meet that need. My role with Tolion is to leverage my network to help connect the company with advocacy groups, patient cohorts, and industry partners to ensure that the people who need this solution most are reached quickly and effectively. By combining scientific credibility, user-friendly technology, and strong partnerships, Tolion Brain Coach has the potential to make a global impact on dementia prevention and brain health. For me, this is both professional and deeply personal. I'm proud to join Tolion Brain Coach in this mission to help people at risk, to empower them with preventive tools, and to contribute to a future where brain health is a priority for all. Thank you, everyone.
Thank you, Wendy. Again, Wendy has the experience of taking care of her grandparents and parents with the disease because of the genetic risk. So you can imagine how passionate she is, and she has been incredibly helpful for us. The next, I'll invite Petr Zmátl to tell us a little bit about the collaboration with the Garmin. You can take this one.
Thank you. Hello. Hello, my name is Petr Zmátl. I'm Chief Business Officer in Tolion. And when we started designing the application, one of the things was definitely the main focus was the seamless user experience. And the most important thing is how to get the data into the application. So when we are looking into the partners, logical steps is that we will be integrating Tolion Brain Coach to wearables. And the key partner which we have announced in May, and now I'm happy to say that we are fully integrated, is Garmin. I know that you know Garmin. I'm sure the name is spreading. Everyone knows that. I just want to highlight the main facts. Except it's a global company. It's worldwide. It has 19,000 employees. The most important thing that Garmin is selling 16 million devices every year. They have more than tens of thousand users connected. So these are the users who are connected with the Garmin devices to the apps and the world outside. And they have done 1,000 researches, and they are focusing on doing more researches on the sleep, well-being, rehabilitation, physical activity, and disease control. So this is why the overlap is so significant. And the data are very precise. They have the batteries and everything. So, and the Garmin devices are lasting quite long. So if you go to sleep, so the Garmin is still on. So basically you can monitor all the things. Another overlap for us when we talk, because there is a special division in the Garmin, is Garmin Health. And Garmin Division Health is focusing on the preventing solution well-being. So that's basically employee benefits for providing the more prevention solution for the employees, insurance companies, payers, and well-being. So this is where we are precisely targeting the same market group. As I said, you can, if you download, and I hope you already did it, so if you download the Tolion Brain Coach app, there is a section where you can link your Garmin devices directly to Tolion and you can import your data. And I'm happy to say that in the crowd there is Lukáš Friedrich, who is the CEO of Garmin Czech Republic, and he's available later on. If you want, you can talk you and me to Lukáš about any question about Garmin. Thank you.
So again, this is one of the first of these kind of collaborations, but you can imagine how important it is for us to be able to get the real life data and the biofeedback we're talking about, so we can follow the impact of the recommendations. So the next, I'm truly pleased to welcome here Jirka Procházka, good friend and true global celebrity. He's actually exemplifies the training and the importance of health, but also the brain health. He will tell you all about it. You can applaud.
Hello, everyone. Hello. What to speak? What to say? I'm really happy for our collaboration that we just catch the right time, but like we are going back to the US to make a big step from Czech Republic with the Czech names and have big impact in US. And I'm really happy that I can speak today about head injuries and all these things. What's obvious about my work. So this is something what's the motivation for me to work together with Tolion, and this collaboration for me means not just to step and be together, but to make Czech brands names really big. And for me personally, it is like right now in this phase of my career and of the life is very actual, because I'm trying to understand my body on the every part, and the brain is the first one, when you need to understand not just opponent, your strategy, what to make better in your training, what to make better in your strategy, in your fighting plan, and what to do better especially in the fight. Because right now, tomorrow I'm flying to the US, and I have 4th of October, I have really important fight in UFC. So I'm happy to be here and speak about that. So the most important thing in this collaboration for me is the healthy lifestyle, because it's not just about to take just one pill and over and it's okay and it's the best. For me, the best something back from this collaboration is that, because I'm working on that many years right now, it's about your healthy lifestyle, because it's not just starting with one pill and over, but it's about to day by day keep small steps. And I believe that Brain Coach. That Brain Coach will help to not just me, but because I will try that. And I believe that it will help a lot of people with not just the problems, but to make the lifestyle much better. Because it's about, like I said, day by day steps. It's about to start understand your brain, your body, which is my work, to work with my body, with my brain, with my focus, with all the senses, with all the habits which you have to do, what you have to do every day, which pills, which medicals, which small things, which recovery things, which challenges you have to do to keep your brain healthy. And this is something what's motivate me to cooperate with Tolion, and I believe we can make a big step in all the world.
Well, thank you, Jirka. As you all know, Jirka has been really inspiring for young generation, and it's really important, actually, as we heard from Greg, to start actually the brain health, 20 years ago. So maybe they can start 20 years ago. And again, best wishes to Jirka in his fight. He's actually just finished training, and we're grateful that he came here just before he's taking off for the US. So I'm going to wrap up with this slide. So my true inspiration actually for longevity and healthy lifestyle has been my parents. They are both in the audience here. They are both in their mid-80s. They are full-time professors in San Francisco. And we always go to Hawaii at the beginning of the year before JP Morgan Healthcare Conference, just to talk science, to talk life and talk brain health and longevity. My mom always tells me all the new developments and everything that I can do better. Again, for us, the health is function. I think it's really important for everybody to invest in yourself, because you will have, obstacles, you have things you have to tackle. And if you are ready for it, actually, you'll be better for it. And again, it's really, really a pleasure to have you all here. And I'll turn it over to Jarda to start through the update on the Czech entity. Thank you.
Okay, thank you very much for the introduction, Martin. In this part of presentation, you will get more information about Tolion Brain Coach, and I will tell you a little bit about the history of Tolion, because as you can imagine, turning an idea into a product, it's quite an adventure. As Ken said, he has gray hair because of Alzheimer's. You can see I don't have any with Tolion. No, I am really enjoying it. It's really fun. And it all started 3 years ago when over a great sushi dinner with Martin in Boston, where we discussed the potential of artificial intelligence in personalized preventive medicine. And it was such a good idea, so synergic with Alzon, that Martin gave me a mission to find experts in AI and medicine and to bring them on board to help us to prepare such a project. As you can see, just in 2 months, we had first team meeting in beautiful Augustine Hotel, where we confirmed that such a project is feasible. And the Augustine Hotel witnessed many of our important meetings, because every good idea needs funding. So we sat down with our friends and investors and discussed if such an idea is worth of investing. And they, with their support, they helped us to shape the Tolion Brain Coach, that we could establish a Delaware company in September 2023. And we started a very successful angel round where we raised more than double than we expected. The year 2024 was about building a company. We established the Czech subsidiary in Prague, and as you can see, we really fast built a large team of experts. And this year, 2025, is just amazing. We've met here at the beginning of the year by the occasion of a grand opening of our offices, and we started the very successful Series A. We have grown to more than 60 experts at this moment, and we attracted so many extraordinary partners, collaborators, and experts. For me personally, I really enjoyed the deep dive with Greg. As he mentioned, it was really inspiring for us, and he showed us so new ways that we could be much more successful than we expected at this moment. What really positively surprised us is that we are recognized as a top longevity startup to be watched in this year. It's a great success, and we are going to fulfill these expectations. None of this would be possible without a great team. Martin already introduced our US colleagues, and I would like just shortly introduce my friends and my colleagues from the Czech management. I will start with Petr Kadera, who is responsible for the technology and AI. Then Ondřej Lerch, who is responsible for the medical knowledge. Zdeněk Kodejš, our Chief Development Officer. Thanks him, we will have the application in November in full version. will be perfect. And Milan Draňovský, our Chief Finance Officer, Petr Zmátlo, his role is really crucial at this moment because we are starting the product in November in US, and Pavel Prucek, the product lead. And I don't have a Chief of Staff, Lenka Kratochvíla. She's responsible for this, that we have such a beautiful event today here. And big thank you to all 60 experts we have on board. As you can see, the biggest teams are development team, medical team, and technology team. And you all are doing a great job, so thank you very much. But the biggest achievement is that we have the application in beta version. We are already testing the application, and we will start this application this November in the United States as a full product. And my colleagues Petr and Pavel will tell you more, and they will tell you bigger detail about this application in a few minutes. If you have any questions, you can simply scan the QR code and send us your question via Google Forms. And for you who are here in person, we have a special prize, a raffle that you can win a day with Jiří Procházka in his institute. So it's for 2 persons. Okay, and now I will ask my colleagues to tell us more about the importance of brain health. Katka and Dra.
Today, more than 55 million people worldwide are living with dementia, and this number is expected to triple by 2050. But there is hope.
In 2024, the Lancet Commission has reported that up to 45% of all dementia cases are potentially preventable by addressing modifiable risk factors. That means your daily choices, your lifestyle can shape your future brain health.
Of course, some risk factors are non-modifiable, such as age, sex, or genetics. I mean, being a woman is a great adventure, but when it comes to dementia, it also means facing the risk nearly twice compared to men. And also genetics can amplify this risk. Carrying ApoE4 increase your chance to develop Alzheimer's disease, the most common form of dementia, up to 4-fold. Carrying 2 copies increase the risk up to 11-fold. But as we know, the genetic may load the gun, but lifestyle pulls the trigger.
The Lancet Commission has identified 14 modifiable risk factors. Some of them may be obvious, like hypertension, low physical activity, or smoking. The other, not so much. Impairment of vision or hearing are among the most impactful risk factor of dementia. Yet, they can easily be mitigated by using correct glasses or hearing aids. But management of even the simplest factors is not simple, because there are so many things that complete the individual picture. Like chronic conditions, like sleep apnea or heart disease, increase the individual risk significantly. And on the other hand, use of certain medications, like statins, or more recently, GLP-1 agonists, the weight loss drug, can act as a protective factor. Not to mention the impact of lifestyle. Small lifestyle choices like diet or supplements have impact too. The positive effect of Mediterranean diet on brain health is well established. But there are other diet regimens like intermittent fasting. And while we may not yet have data on brain health, we know that they do have significant impact on other risk factors, such as hypertension or cholesterol levels.
But we know that every person is different. We have unique habits, we have different chronic conditions, and of course we take different medications. And these factors don't act in isolation. They interact with each other in very complex way and connect and create very complex network. And on personal level, many questions arise, like which of these factors matters the most for me? Where should I start? Or most importantly, how can I effectively manage all these factors?
To put it simply, lifestyle matters. This year, we learned from largest intervention trial in the US that combination of small lifestyle modifications can have important effect on brain health. From this study, we learned 2 things. First, that small lifestyle changes do indeed improve cognition and reduce the risk of dementia. But second, perhaps more importantly, that the targeted specific interventions are much more effective than non-targeted, non-specific ones. As we have heard from Lancet Commission lead Professor Jill Livingston, the interventions may be the way ahead, but they need to be personalized. It's ridiculous to prevent a risk that is not present.
Yes, because especially in dementia prevention, one size does not fit all. For example, social activities. Good social engagement is more protective in Asian populations compared to Europeans. Good social engagement reduces the risk in the Asians up to 40%, while in Europeans only by 10%. And also we know that genetic backgrounds can also influence the effect of lifestyle interventions, such as physical activity or diet. Did you know that ApoE4 carriers benefit 3 times more from Mediterranean diet compared to non-carriers?
And that is why we created MedWiki, our proprietary knowledge base. It's a Wikipedia-like system that contains highly processed information about factors affecting dementia and brain health. To be able to do this, we have gathered a team of currently 14 professionals in the field of dementia, including cognitive neurologists, psychologists, biologists, psychiatrists, anesthesiologists, biochemists, and physical therapists who continuously monitor the scientific literature for latest developments on dementia and brain health. We currently evaluate more than 100 factors and are still adding new ones. We look for the relevant information, including mechanisms of action, how the factors is associated with other factors, or how it affects dementia risk. To illustrate the depth, let me just tell you that we collect over 200 data points for each individual factor. And we also take pains to be able to track each piece of information that we use back to its original scientific publication. This way, we are able to assess each factor individually, but also in terms of how it interacts with others.
But no single physician can process this amount of data, not to mention the information overload with more than 20,000 papers on dementia published every year. This complexity overwhelms both medical professionals and patients, who are often left lost in the sea of information.
And that is exactly why we need Tolion Brain Coach, to turn this overwhelming information into personalized practical guidance. Thank you. And it is now my great pleasure to introduce Pavel Prusek, our product lead, and Petr Kádera, our Chief Technology Officer, who will tell you more about Tolion Brain Coach.
Hello, everyone. So in this section of the presentation, we will walk you through the Tolion Brain Coach application. I'll be guiding you through the application from the user's perspective, and my colleague Petr will walk you through the application from the technological perspective, what stands behind the scenes.
Like it or not, but AI is currently reshaping our lives. Through online streaming platforms, it changes the way how we entertain ourselves. Through e-commerce platforms, it changes how we build our shopping desires. And through smart driving assistants, it changes the way how we control our cars. Healthcare won't be an exception. And during next minute, we will show to you our AI engine starring through Tolion Brain Coach in various roles. As an exact detective, as an empathetic companion, as a tactical trainer, and as a wise old man which supports you through whole lifestyle change.
But before we jump into the walkthrough, let me just firstly highlight where we are in terms of product development. In June this year, we distributed our alpha version of the application to our internal team members in order to prepare for the further stages. This was a diary study which followed in August, where we cooperated with participants, carefully selected participants on the US market at increased risk of dementia. With this initiative, with great help of Wendy Nelson, I'm sending greetings, we managed to connect with those people, gather precious feedback from them, and iterate the application into the stage where you can see right now. So today, we are distributing our beta version of our application, which is now available at TestFlight. You can download it from there, and you can start testing yourselves. One remark in here, just be aware that this is still not a feature-complete version of the application. The full version will be available in November when we aim to release the product on the US market. And now it's the time to actually walk you through the product. So as always, the user journey starts with the onboarding. So we need to assess and understand your unique risk profile. So through carefully designed questionnaires, we gather essential information and we guide each user through the most relevant journey. Each question is grounded in evidence-based science, making sure we are assessing the risk profile with accuracy and confidence. But we don't stop at self-reported data. Our approach is to integrate multiple sources, from user input to wearable devices like Garmin, and also medical records. This serves as a foundation for our personalized recommendation, ensuring that every piece of guidance is aligned with user needs.
So our biggest priority is to be always clinically grounded. To achieve this goal, we created a system that enables us to collect evidence from thousands and thousands of scientific publications, integrated into our proprietary MedWiki system, which is a Wikipedia-like system that's structured in the way that it efficiently bridges our Med team with our AI engine. And because we want to be always very exact in the way how we assess your risk, we transform this textual representation of medical knowledge into a machine-readable way, creating our proprietary medical library. So having done this tedious proprietary work, we can invite logic-based reasoning on the scene, which has two great advantages. It's deterministic. It means that to the same question, it always responds the same answer, and is explainable, so it can always trace back the answer to the evidence, to the original scientific papers. To explain how this works, I decided to use an analogy with a detective. So we can imagine the Tolion Medical Library as a crime theory. The user data are clues at the crime scene, and the automatic reasoning using logic is a detective at work. So this detective puts together the clues which has currently available and derives a conclusion. And the great advantage is that it can also explain the why, how he concluded this. So get back from this detective analogy to medicine. So imagine that we have a user, it's a woman, she is 40 years old, and we know about her integrating data from Garmin, that she is not very physically active, and she also suffers from a bit high body mass index. So our detective goes through the evidence coming from more than 3,000 publications and finds a conclusion that for this combination of data, this woman is expressed to risk more than double comparing to average people of her age and sex. Even more, we also identify that if she decreases her BMI, the risk will decrease to 1.1 only, or if she is more active and exceeds certain level, it can be even protective, so her decrease is below the average value.
Yes, and to demonstrate these functionalities, we've prepared a couple of sneak peeks from the application. And on this particular one, I will just follow up on Katka and Ondřej as they were talking about the importance of social engagement in the different communities. So basically, to assess such risk, we've prepared a questionnaire which assesses the risk of social isolation. It's a very quick one, 3 questions, and based on those answers on those questions, we assess the risk of social isolation. And if we identify such risk, we are then following up and preparing the right set of activities that are specifically designed to mitigate such risk. One of the most powerful features of our application that has been also validated by our participants in our diary study is the conversational brain coach. It is an intelligent AI chatbot that feels less like a technology and more like a trusted companion. It delivers tailored guidance that is making sure that everything that you experience in the app is personal and relevant. It's designed to be empathetic, encouraging, and non-judgmental, meeting you exactly where you are on your journey. It helps you reflect on your progress, celebrate your achievements, and points out where are the spaces that you should improve. And importantly, it translates complex health concepts into simple, everyday language that anyone can understand. With optional voice interaction, the Brain Coach is even more accessible, making it easy to engage in a way that is natural and effortless.
And at this moment, the AI comes on the scene in the role of the empathetic companion. It adjusts the communication to your type of personality with one exception, and it's the clinical accuracy. So all you get from this chatbot is grounded in the medical evidence, but it's delivered to you in a way you can get the biggest utilization of it. So it focuses on the most important risk factors you are exposed to, and it communicates in the way that's natural to your type of personality. So through the interaction, we identify whether you are suffering from fear of rejection or whether you are motivated, especially by achieving goals. And we adjust the communication to really target at the points you are sensitive to.
And to demonstrate how the chatbot and the interaction actually looks like, we've prepared 2 real-life examples that we gathered throughout our diary study. I just want to stress out that these are real-life examples that actually happened, and we just anonymize the data so that we can use it for the demonstration. So in the first case, there is a participant looking for an advice on foods that are rich in healthy fats. And the Brain Coach immediately suggests a list of suitable ingredients, but when the participant mentions that she's allergic to almonds, the Brain Coach immediately suggests an alternative options. However, it doesn't stop there. It goes further, and it even provides a recipe for an avocado salad, which turns the tip into something truly actionable, but also delicious. The second example is more the demonstration of how the chatbot can actually align with the level of expertise he's talking to. So in this case, it's more the case of a heavy user, which knows quite a bit about the topic of brain health. And in this case, this participant is trying to confirm the levels of p-tau, which is basically a biomarker, which is very important for brain health. And she's asking whether her level of p-tau is actually within the range. The Brain Coach responds not even that she's okay within the range, but the Brain Coach also suggests certain activities that are reducing or even that are keeping or even reducing the levels of p-tau.
at this moment, I would like to invite you, if you are testing the application and if you have time just for one feature for this thing, focus on this brain coach, on this chatbot interface. Also, the system is currently not feature complete. This part has access to the full medical library, and you can really challenge the system with a very high level and but also very detailed question.
And in this way, we've shown you one way how you can get an advice from Brain Coach. The other way is the activity recommendation page. So each week, usually in the beginning of the week, you receive a curated set of activities for the week that are tailored to your unique risk profile. These aren't just generic tips. These are targeted interventions that are specifically designed to mitigate your specific risk factors. Completing those activities contributes to a weekly goal, which creates a sense of progress. And because participation is fully optional, it gives you freedom to choose the activities based on your preferences. In this way, activity recommendations turn science into simple, practical, everyday steps.
So in this role, the AI acts as a tactical trainer. So the goal here is to transform what we know about brain health, what we know about you, into a list of actions you can and you will really conduct. So in contrast to the health detective, here we also pay attention to your preferences. So we don't only deal with the hard medical facts and hard health data, but we also listen to your preferences and to your troubles. So for instance, if you share through the chatbot with the system that you harmed your hamstring because you constantly underestimate the warm-up phase before you do running, as for instance I do, the system won't recommend to you running for next couple of weeks. So when we generate a list of activities that are aiming at your problematic factors, we use the outputs from the detective to compute actually the impact of these actions based on the relative risks of the factors we are aiming at. We use AI to select the right graphics to make the actions also visually attractive, and we present it through the application to our users. And at this point, the system doesn't stop its work because it carefully observes what you pick, in which order, and how successful you are in fulfilling these actions to be even better next week when we are proposing another set of activities for further use.
And again, to show you how the activity recommendations actually look in the application, we've designed an activity page where you can see that the activities at the top are those that are already selected in your weekly plan that you are already putting in practice. And the other activities, as you can see, recommended for you, these are the ones that are available for you to choose from. Here we can have a look at the example of the activity of, for example, brisk walking. This is the way how you can manually add the data to the activity. And for those of you who would like to have seamless experience, you can definitely connect your Garmin wearable and let the data fill for you. Then from the recommended activities, you can have a look and find some details about those activities. You can also have a look at the risk factors that those activities are mitigating. And then, for example, you can initiate a contextual chat where you can find out more information about the risk factor. And then, if you are convinced, you can simply add this activity into your weekly plan. And as we are getting towards the end of the week, you will receive a weekly summary, which is an AI-generated review highlighting your achievements, space for improvement, and overall progress. This regular check-in creates a habit of reflection, helping you stay motivated. It also opens a conversational feedback loop, allowing you to share insights for the upcoming weeks. We then collect those insights, and based on that, we'll generate a new, fresh set of activity recommendations for the upcoming week. And in this way, weekly summary becomes both a moment of reflection, but also a launchpad for the continued progress.
So in this case, the AI acts as a wise old man that all week long walks behind you, observes what you are doing, and once a week knocks on your shoulder and tells, "Oh, look, we have noticed that you are doing this and this. It's perfect, so you are working on yourself, or you can do something better. Don't stop. The life is about change and continue." And invite you to continue in your journey that can do a lot for your health in the future, also for next weeks.
And again, if you look at the application, at the end of the week, let's say on Sunday, you'll receive a notification, and then your weekly summary is ready. So here you can see what the chatbot, the brain coach actually generated for you. And as I said before, you can share your feedback, what worked, what didn't work for this specific week. And also based on this feedback, brain coach then generates a fresh set of activities for the upcoming week. And again, it's completely up to you whether you choose to put these activities into your weekly plan for the next week. So let me wrap it up. If I go back to the journey, we'll start with assessing the risk profile of the user through carefully designed questionnaires. Then, after we've created a risk profile, we can generate the first set of activities. Once the user selected the preferred set of activities, we are generating every week a weekly summary, which is a space to basically gather feedback and reiterate the set of activities for the next week. And this way, with small, basically everyday steps, we will make sure that the lifestyle change actually happens.
So think of the system as a supportive medical consilium which identifies where it can help you, it guides you to the lifestyle change. And the best way how to get more information about it is to download the beta version and test it. And again, I highly encourage you to focus on the chat-based features. Be challenging, put hard questions to it, compare your lifestyle habits you have now, and see how it affects your future.
But before we do that, let me just wrap it up with 3 key differentiators. So first, the application is clinically grounded and personalized because it's tailored to your unique risk profile. Second, it's holistic. As you've heard from Katka and Andrzej, we cover plentiful of risk factors and it is constantly evolving. And third, it's scalable. It's cost effective, it's built for scale, and it's accessible to anyone. And now I would like to very much invite for downloading the application and start testing it, because especially me as a product guy, I would be very happy to collect feedback from you, because as I said before, the next step is the commercial launch on the US market in November, and with your precious feedback, we will be able to iterate and refine the application. So thank you very much for your attention, and now Petr Zmátlo will talk about the commercialization of the product.
Thank you.
Thank you guys very much. So I appreciate the great introduction of the beta version of Tolion Brain Coach. And I would like to talk about what are the plans. Sorry, this one. So I'm happy to confirm that we'll keep our promise. And the promise is that we are launching Tolion Brain Coach on US market before end of this year. Our target groups on US market only is 15 million people who has a higher risk of dementia. Because of the DNA, because of the predisposition, the family is worried about traumatic brain injury. So the group is there. How we want to enter the market is that we will adopt and use the strategic channels. These are the people who are putting together the cohorts and advocacy group of the people who has a higher risk. One of the outcome of the UX study which we have done by this with these groups, so already with the people who are affected are coming from this group, is that there is a high demand for the Tolion Brain Coach, and we have validated the need for the Tolion Brain Coach. So in this group there are 2 million people. So now we have a solution to help, and we know who are the people, concrete people in this group. 2 million. It's a huge number, and I'm sure we can help a lot of them. If I'll name the cohorts and the advocacy groups, so starting from the research institution like Emory University, looking at Us Against Alzheimer. Us Against Alzheimer is envision the lifespan to be equal to the brain health span. Then there are the Alzheimer Association. Alzheimer Association is focusing on reducing the risk and prevention and doing in the researches. Apoy for Alzheimer Alliance, this is one of the, Wendy Nelson is key member of this alliance. This is a group of people who are putting together patient, caregivers and healthcare professionals together, and they are directly impacted by the Alzheimer disease. And there is the Apoy 4 group, which is the group of ordinary people who just take care about the life and loved ones. Another strategic partnership for us is Garmin Health, because the integration to wearables and seamless data integration with us is access to all the tens millions of connected users will be interested in using the Tolion Brain Coach. How we want to approach this given cohort and clearly define the group of people. We have defined a special program. One of the things was thanks to Greg as well, that he has opened our eyes how to do that. So we have prepared a special program licensing and how we want to give the solution to the people in this group. We will run the educational campaigns. We will run the webinars. We already have agreed with Wendy Nelson that as our ambassador, Jiří Procházka will be engaging with us as well to get the spread to the people who are in need and who are really in desperate to just have a solution because there is nothing out there. That was the B2C approach, but in the same time we are developing the B2B approach, and that will be the channel for monetization and even spreading the solution to the wider cohorts. One logical step is definitely integration with laboratories. They are running the program, so we'll be sending directly from the Tolion Brain Coach the people for testing to get the result, to be sure that what are the next steps on the risk assessment. Pharmacies will be for the tests as well, but there will be as well the channel for the supplying supplements, and we would like to become a preventive hubs with the pharmacies, because they do as well access to the people from outside for the researches and etc. Payers, this is one of the critical group as well, because the estimate of National Academic Organization is that if the person develops Alzheimer's, the cost for that is $700,000 per that person. So there'll be, we want to run the programs with payers to significantly decrease the cost, not just for the insurance companies, but as well for the society and as well for the companies, as well for the families, excuse me. And last but not least, concierge, medical and other organizations that we would like to work with, and we have prepared the special programs for them. So I would wrap it up there. As you can see, the demand is huge, and we have a solution, and we'll be able to provide the solution by end of this year, and this will have a huge impact. So if I'll take just the numbers to remember, there are 15 million people in the United States who has a higher risk, and there are 2 million people from this group which are already built these cohorts and advocacy group, and we can approach them, and we have a team for that. Please join us on our journey. Give us your feedback. This is initial beta testing in test flight, but download the app. There is an integration with Garmin data. Use the chatbot. Give us the feedback, because in November we will have a full reach set application which will go live in US market. And then if you want to stay informed, that follow up us LinkedIn, join us as well, scanning this QR code as we are putting there the latest information, sharing the team results, where we are heading with the development and everything. And this is the way how to live smart, stay sharp. And now handing it back over to Martin for the questions.
All right, everybody. This almost completes the formal agenda. I'm sure you have a lot of questions. We'll keep it in English until we wrap up, actually. And we have a lot of questions from the online group, because there are a lot of people joining online. So let me start, and I'll always call out the chiefs actually who are responsible for, or who can answer those. So this is a question that actually came quite often. Everybody's using ChatGPT. Everybody's using these tools, and the question is, how do you differentiate your product from the likes of ChatGPT or other generic chatbots? Petra? Join me here.
So I'm ready for this question, because first I'm going to take from my wife whether we are not doing something completely useless, because ChatGPT is accessible to everyone.
Are you spending all the time doing useless stuff?
I really had to formulate I think very carefully. And the best answer is that actually it's something like a ChatGPT with a cheat sheet. The cheat sheet is a proprietary medical knowledge base, so the answers are coming from the evidence, from the publication, not from the memory, as in the case of ChatGPT. But there is more than that. Our system has access to your personal health data, so it interprets what we know about you through the medical knowledge. So, and currently there is no better way how to check the difference, because you can download application and you can compare what answers you get to the same questions. So feel free to test it.
And I'll just add to it. So again, we have a structured knowledge that actually is very applicable just to you. That's what Peter has said. We also don't hallucinate like the ChatGPT, so you can actually rely on it. We really know why we actually giving those recommendations and so forth. So I think this is really important differentiation. So the other question is, how can genetics affect lifestyle choices? Are there differences in recommendations depending on my genetic profile? This is for Katka. I think best suited. So as you know, we're working with the high-risk patients, so patients who have this disease in their families. They have a high chance that they will get actually the disease. For those who don't understand ApoE4 risk, so if you have two copies, over 90% of people will have by age 65 the brain changes. So it's called semi-dominant. So they really, and the impact of lifestyle could be very dramatic. So, Katka?
Yeah, to answer simply, a lot. Your genetics really influence your lifestyle choices. One of the examples I already mentioned is the Mediterranean diet. I think this publication was 2 months. It was published 2 months ago in Nature Medicine.
Correct.
And it shows us that
Juan Fortia. I just met with him in Barcelona, actually. We talk about it. Yeah.
It's very interesting, like that Mediterranean diet is more beneficial for ApoE4 carriers, that it reduces your risk up to 30%. But you can have different variation, like if you're ApoE4 and you have BDNF, vulval polymorphism. BDNF is a very important gene for your neuroplasticity. Neuroplasticity is the ability of the brain change the shapes, change the synapses between different regions. We cannot grow up new neurons, unfortunately, only a little small amount. But we can do a lot with your workout, and BDNF helps you to create this new connection. So if you have BDNF vulval polymorphism, it means that if you work a lot, if you will run every day, it will really help you to develop these new connections. So, for example, if you are ApoE4 and have this good BDNF gene, it will be good for you to run instead of eat Mediterranean diet. So we can really do the recommendation based on your genetic profile. The problem is that not many patients or people are not so brave as me or Andre to undergo genetic testing. So now we know our profile and we know what is the best for us. And there are many more, like TREM2 really influence how your brain can clean the garbage in your brain, which is a lot. So if you have detrimental allele of TREM2, for example, you have to focus on anti-inflammatory diet. And there are many more, of course.
So now you see why you need our product to translate it into actionable insights, because there's a lot of genetics actually you just heard, and this has been very scientific. But I'll just add to it. So I actually got my PhD on working on ApoE4 in Alzheimer's. You know, what is the biological basis? I was in grad school, again, wanted to work on something completely different when this connection came about. But what is really striking that ApoE4 is the ancient allele. It's really the ones that we had 70,000 years ago were running on the steppe and were just, you know, running around when they were chased by the lions and eating, you know, some bugs and berries. So at that actually was this kind of lifestyle and diet. The ApoE4 was actually the best solution. Now, which is quite incredible actually, over the past 70,000 years, we evolved and we developed the ApoE3, which is the most common variant, and even ApoE2. So we're adapting to it. But if you go back, you know, almost to that, you know, lifestyle and diet, you can address this genetic risk, which really drives, you know, a majority of Alzheimer's disease. And I need to open this because it's shut off while we're talking. So the next question, which is also a very good one, is the, you know, so we're releasing the beta version. What is the difference between beta version and the final product, Pavle? So we're in the starting blocks obviously of this product, and this will improve, and hopefully with your insight and input will dramatically improve. But Pavel will tell you what it will improve.
Sure. So so the good news is we are getting closer. So there are only little, little pieces that we need to polish. As you've seen, we are now creating a sense of progress by showing you which activities you are performing. So basically, on a short-term basis, we can give you an insight on how you are doing short-term. In terms of long-term changes in your, let's say, status of brain, it's something that we would like to add, and this is the factor page, as we call it, where we would like to show how you are doing in terms of individual biomarkers, but also on top of that, we would like to build something that we call brain health score. Yeah, so basically long-term, how you are changing your status or state of brain.
And risk profile. Great. Okay, great, thank you. The next question is for Andra. What is the best strategy approach for me to prevent dementia? I think this is a good way to follow up. And is there a genetic recommendation for people how to prevent dementia? Head injury. Again, one of the major risk factors for dementia is brain injury.
Sorry, what was the question again?
What is the best strategy or approach for me to prevent dementia? This is the neurologist who sees this, these patients every day in his clinic.
Okay, this is the one I do get often as well as a practicing neurologist. To be frank, the simplest answer would be, well, use our application.
Exactly. Simple.
I mean,
this is exactly why we developed the tool, right?
I don't know who this question is coming from, so I don't know any of the background and possible other things that may be influencing it. But with this knowledge, of course, perhaps our textbook would be able to provide much more detailed answer. But the generic place where to start, and what I'm telling my patients when we discuss these things, there's a lot of things that you can actually work on, and it's difficult. It's important to focus on what's important, and if you don't know anything else, the good starting point would be the 14 modifiable factors reported by Lancet Commission. That's definitely a good way to start. But then, of course, not everyone's reading the foreign literature for recent updates. So if I was to come up with a very short rule of the thumb, I think moderation in everything is kind of a good answer, right? Yes, alcohol consumption is a risk factor of dementia, but having a glass now and then doesn't really lead to cognitive impairment, while severe abuse may. Mood fluctuations now and then, again, this is something that's normal, but severe depression can have long-lasting impact on your brain. So yes, the moderation would be the key, unless you can use our app.
Okay, thank you, Andrew. So I would correct him. Actually, his previous slide showed that if you drink less than 6 drinks, actually 25% reduction in the dementia risk. So you really need to follow the science. I would add to that actually one other point. The first law of biology is use it or lose it. So just be active. Health is function. You really want to be active. You're investing in your future, in your life, and in everything that may come along. So I'm sure if there are any questions from the audience, happy to answer it now, please. And can we have a microphone? I was expecting my mom to ask questions. She's always having the most. She has a lot of questions, I'm sure. She's like,
excuse me, you spoke and it was on screen. There are about 55 million of illness people, but it cannot be correct number because we don't know, and you have no correct information from China, Russia, Africa, and other.
You're absolutely correct. So I'll tell you. So I've been to China. I would probably not go there now, but about 6 years ago was invited for one of the conferences, and the burden in Chinese population, they have 1.3 million people, they estimate about 300 million people, just because they have the single child policy. This is kind of the time bomb that is going to explode. Some of you may know that the current population of 1.3 billion is expected to be about 600 million by the end of the century. And again, I completely agree with you. This is in the Western world, the 50 million number. Andrzej, you have more to add to it?
Yeah, I just wanted to comment on that. While we may not be exactly sure, this is the number that's reported by the World Health Organization. So this is, the most relevant number we can get to. So yeah. It may not be accurate, but it's as good as it gets.
I like the estimate about 500 million people of actually brain changes out of the 8 or 9 billion that are on the planet. And my mom is going to have the last question, I guess.
Tricky questions.
A tricky one. She always has tricky questions.
Because prevention needs years, okay? When and how you will analyze outcome of this brain coach?
That's a great idea. I'll turn it over to our chief. Andrzej, I think you can.
No, I think this one is for me as well. So obviously, we are going to start collecting data as soon as we launch the app. And at the same time, we are in conversations with multiple partners within the US, and we are designing a randomized controlled trial because we would like to, in the end, be able to prove our efficacy, right? As I have shown, the US Pointer, which is the large US intervention trial, has shown that there is effect to multi-domain interventions, and they have shown that targeted interventions are better than non-targeted. And we would like to prove that without doubt that we can do perhaps even better than that. And in order to do that, we of course need partners. We would like to run that within the US. So we are talking with a number of people, not to get patients, so to speak, or users of our application, but to get a well-defined cohort of controls. And I think we'll analyze the data as they come. At least 2 years of data acquisition would be adequate. This is how all the intervention trials went.
So my mom is absolutely correct. The proof is in the pudding, so we will need to actually analyze this data. Really, so at Alzion we work with thousands of patient data, and we're building the AI model and so forth. But we will not have access to these, hundreds of thousands and millions of people and data points. And actually showing the real impact of these is the only way actually we can do it with this kind of app. And we have the technology. In fact, crunching the data is the easiest part of it, right? Because you can just follow the trajectory, the interventions, and do a multimodal analysis and so forth. But it's absolutely correct. We have a scientific team that is excited about actually publishing on all of this, and we may have insights into working of our brains that nobody else will have because, again, of the data that will be available. So, well, I'm really grateful for all of you for joining us. This has been really a pleasure to have you here. Again, I'm grateful to all our collaborators, our investors, everybody here on the team. It's amazing to me that in 2 years we have gotten this far. and then we're just about to launch the product. We again, as you heard many times before, we're looking to your feedback. We're really looking for ways to improve the product. We want people to use it, and again, looking forward to working with you further along. There are some fun things that are going to be happening now. I'll invite Terka to talk about it.
Thank you, Martin. So now is the last part of the day, and I would like to ask Jiří Procházka. Sorry, what's wrong? Oh, okay. I would ask to come Jiří Procházka to the stage and tell us what is the prize and withdraw the lucky winner.
Oh, lucky winner. Winner. Yeah, there's a raffle for you, and the winner will win the. This is the prize. The prize is like we have 29th of November. I'm making every year many these events, like a day with me, like with many people, and it will be like not just a training day, but you can watch how I'm training, how I'm working with all these things, like because I spoke about that thing, like I don't need to work just in a cage fighting, like as an athlete, but as all these things, like mentally, physically, spiritually, and take it in one, give it in one, and how to do it in the best way we can do that in the world's level. So this is the prize. Hope you will enjoy that. So it's on you.
So you can withdraw.
Okay, it's on me. Okay. How many? Just one. Okay.
But the prize is for two.
Pavel Debílek. Pavel Bílek. Man. I don't know if somebody make something like.
Congratulations. Yeah, doctor.
Doctor. Oh. Congratulations.
Thank you. Děkuju moc, z vašich rukou je mi velkou ctí.
Tak se vidíme. Máte zkušenosti s bojovými sporty, s bojovými Tak super, aspoň se seznámíte. A to bude přesně tak skvělý zasvěcení do tohoto životního lifestylu, tedy toho zdravého životního stylu, který právě je ta prevence.
I'll pass you this one.
Yeah, I'll just add to it. Actually, I'll say it in English because we still have a few people online. So one of the things that we wanted to do, it's not so simple actually to do these lifestyle changes. It's not so simple how to exercise. Jirko, just stay here for a second if you can. So it's really a science, and we were actually always thinking about building centers where you can actually train people. Come in, it's almost like a fine tuning that you can train people to actually do it well and do it effectively. And this is what we would like to collaborate with Jirka, because again, he wants to build a center. He's building it actually in Brno already, but maybe we can learn and collaborate on this to actually help people be much healthier. So great, thank you. And I think we will shut off the online. I think we completed this session. Now we're switched to check and celebrate. So thank you all. Skvělý. Hele, hodně úspěchů.